All right, we're live again, and I'm here again with Dave from NYC Pain MD, and he's going to talk about car accident injuries today. This is important. We get a lot of questions because NYC Pain MD are experts at treating pain, and everybody knows that they treat knee pain, back pain, neck pain, and stuff, but they didn't know if NYC Pain MD treats specifically car accident injuries. And Dave has some great information here that you should know if you've been in a car accident. So Dave, you're here?
Yep, I'm here, Brad. Thanks for having me. Yeah, by the way, I would just add that I think it's traumatic injuries, also auto accidents. I've been getting some emails on what do I do if I'm injured at work or I had a fall or a sports injury. So they all kind of fall into that category. But you had brought this up to me by phone, and so we're kind of shooting from the hip here on this 100-degree day here on the East Coast. But let's see if we can give you guys out there a little bit of guidance on it, because this can be very crucial. And sometimes these type of accidents turn out to be life-changing events. So it's really important that they be handled properly on multiple levels. So let's say you're on the scene. And again, whether it's an injury where you fall off a scaffolding at work or a ladder, or you're in an auto accident, the first thing is don't start dealing with the other party right away, and don't leave the scene of the accident. That can be looked at as illegal, like you're trying to avoid some legal issue, but don't leave the scene. Particularly an auto accident, call the police. Get a law enforcement officer there that documents that incident took place. If it's at work, call your supervisor right away. Don't go to your supervisor a week later saying you fell off the ladder and hurt your ankle or your hip or your back, because it doesn't really look, appropriate. So if you auto accident, do not leave that scene. Call a police officer right away. Let them come. Don't deal with the other party and say, hey, let's deal with this on the side, because you don't know who these people are. They even have insurance, if they're legal, if they have contraband or whatever in their car. Just don't do that. But also an important thing, if you do not feel right after an accident, of course, you tell that police officer you're not feeling right, and they'll either get you themselves or get an ambulance to take you over to a hospital. But even if you're not feeling right, there's something called DOS, delayed onset syndrome, where you may not, the car may be a mess, but you may not feel particularly bad or injured or pain. But this delayed onset syndrome, you may not feel the pain for hours, days, even weeks later. This is pretty well documented in the literature. So get yourself to a doctor in short order to just to check you over in any case. And of course, maybe take pictures of the accident. Everybody has a cell phone now. Take a picture of the damage to the car. Again, more documentation. And another one might be, as soon as you can, contact your insurance company, report the accident, let them know what happened, and then follow up with the law enforcement agencies, or in a case of work comp, with the management, to get reports that you reported this and document this with the proper sources. So all this is really important. Of course, number one being your health, because accidents and traumas and falls and motor vehicle accidents, they cause damage to the human body, and it should not be taken lightly. Step two, we kind of talked about it before we got on, is, a lot of patients or people think, yeah, I'm going to go to an attorney right away, and that's fine, but the attorney is very well educated in filing reports, making legal cases if it's appropriate, but they're not physicians. They're not doctors who are trained in diagnosing, analyzing injuries, and recommending proper treatment. One of the issues with delayed onset syndrome and these type of injuries is that injury may, if that gets out of control and it remains dormant and untreated for a long period of time, you go to the wrong doctor, he misses the diagnosis, doesn't send you for the right test, doesn't get you under the right treatment, that minor injury may turn into a major problem for the rest of your life. As I stated earlier, these decisions that happen can affect you for the rest of your life. So very important, you get examined by a doctor or a group of physicians who is trained in traumatic injuries to the back, neck, shoulders, hips, etc. Even sometimes there's head injuries, may need a neurologist or some sort of other testing. But make sure the proper expert is evaluating you. You had another question. I think he asked me, like, what about the attorneys referring to the doctor and so forth? Correct, Brad?
What about, you have a car crash and then you go see an attorney and the attorney sends you to a doctor?
Right. Well, while there's nothing wrong with that in and of itself, if the attorney's a big personal injury attorney, quote unquote, often they'll have relationships, friendships, professional relationships with various doctors that there's just a list. Oh, you injured your back, go here. You injured your shoulder, go here. You have head trauma, go here. And while there's nothing wrong with that, this may not be the best route for you to go. I'm not making any comment on attorneys or anything like that, but you have to find out, is this the best doctor for you? Are you comfortable with that doctor? Is this just a doctor that runs a mill of auto accident or work comp patients in and out and gets referrals from his attorney and has ongoing working relationships? Or is this a doctor that really cares about you? Because while the legal issues are important, the doctor's job is to make sure that you minimize that injury and get it treated right and aren't left with debilitating and lifelong issues from these accidents, which can happen. Going back to delayed onset syndrome, a lot of things that can happen, say in a herniated disc in the back or neck, is the accident can cause a little minor crevice or crack or just a little bit of damage to a disc. If treated properly, the disc maybe will heal up over time and never become a problem. You don't get in there right away, of course, that disc can eventually crest fully, give out. You can blow out the disc completely and have a complete blown out herniated disc requiring spine surgery, fusion, and just a whole mess of complicated things. So, you have to do a little research on your doctor and make sure you're going to the proper doctor. Maybe call your primary doctor for a referral, or find out if the doctors you're going to are really going to care about you, and you'll get a feel when you go. But I would be careful about just going along with what your attorney says. Listen to their legal advice, but they're not doctors and they should not be guiding your medical care at all, in the opinion of myself as well as all the physicians that work with the NYC Pain MD group.
It really seems like there's a couple separate things here. There's the medical care and there's the legal aspects of a potential case. If I'm hearing this right, you should choose your doctor or doctors experienced with this type of injury, and they've treated this type of case a lot, and you want to get the medical results, and you want to get the best possible treatments. And then there's the legal stuff. And if there is a case, you want to make sure you have an attorney who can deal with that, but you also want to make sure your doctor who treats you can document the case, correct?
Yeah, I couldn't agree with you more. Of course, if the doctors or the group, like our group is very well trained in these type of issues, but the doctor you go to not only has to be able to diagnose, analyze, and recommend proper treatment post-accident or after the accident, they need to really be able to write detailed examination reports, document the analysis, whether it's an X-ray, an MRI, a scan of some sort, and put it together with a coherent, writing everything down, documenting in a computer, notating things on a timely basis, making sure to get a detailed, thorough history of exactly what happened, a patient's prior history. So that is what's called, exactly, you use the word documentation, because should there be legal activity, whether it's work comp or a fall down or an auto accident, if that documentation is sloppy by the doc, you basically could probably kiss that case goodbye. The attorney won't be able to do anything with it because it's not a coherent overview of what happened to the patient.
Probably why attorneys have relationships with some doctors, and that these doctors are going to document the case, I'm guessing, because they've dealt with them before. But that doesn't mean that they are the best experts for treating the injury.
Right, that's a good point. So that if the doctor is good at documenting but not being good at doctoring, that's not a good scene. If they're just a good doctor but sloppy with documentation, you've got a problem. So you need both. You need doctors that are experienced treating physicians and documentation physicians, understanding that at some point every word they fail to put down or don't document or get sloppy with or incoherent, it's going to be a problem for that patient and the case down the road.
What's NYC Pain MD's experience with treating these types of injuries?
Right. So just to start, NYC Pain MD, of course, really focuses in non-surgical orthopedic type injuries. We do all sorts of medical procedures to get patients moving again, feeling better, and out of surgery. And this is what we see: the neck, the back, the herniated disc, the pinched nerve, the migraines, lots of shoulders, and of course, I don't know if the right word is famous, but we're very well known that throughout the tri-state area for our special progressive knee pain treatment programs, non-surgical. So we're always treating these type of injuries, but of course, along the way, patients would present with various histories, auto accident, falls, work. So we really took it seriously and what we call our electronic medical records of specific documenting templates. So everything is taken down. We don't forget anything. We review it in detail. We follow up. We get the patients for the testing or the MRI if they need it. We make sure that the reports written by radiologists are thorough and detailed. We don't just sloppily throw electronic medical records and case records together. So these are followed up on. This is very important. It's time consuming, but if you don't, down the road, you've got a problem with the documentation. We're known for being able to treat these injuries. What's not really known, and where patients have been emailing me, is about all this stuff. Can you help me with my claim number? Will you document? Will you work with my attorney? Will you work with my other doctors, et cetera? And of course, these things. The answer to that is yes. Of course we will. The one thing that I would want to make a note on is there are, and I can't be specific about it, but there are a certain group of docs and attorneys that they kind of are, look for all these auto accident cases. This is not what we do. We look to help patients. If patients' injuries or pain or discomfort come from auto accidents or work comp injuries, we know exactly how to treat them. We know how to document. But we're not an auto accident mill. We're not a work comp mill where we just run people in and out. The care is very thorough, and this is not the kind of place you should go if you had a minor injury and you're trying to just make a case. This is not our forte. We won't really deal with it, and we discharge patients who we feel are kind of, exaggerating their claims and so forth. So that's our stance on that.
Important what we just said there, because personally, injury, work comp and stuff, it gets a very bad name because there is some shady stuff goes on both sides of it. Patients who just want to get a claim, and other side of it who just pushes claims through. What you guys do is you guys are doctors who are treating the patient the best way you possibly can. And if someone is in a car accident or injured at work, you guys are going to treat them the best possible way you can. And you're also good at documenting the case if it's necessary.
Right. And I think I brought up that point about we don't want these, malingerers or people exaggerating cases. So people will know we're serious about treating these injuries. On the other side, I want to mention one thing. A lot of times it can take days, if not weeks, to get claim numbers and so forth, more so with work comp, it seems, and auto. But if you're injured and if you feel you need attention and you're having pain, our office does offer a no-cost evaluation and consultation. So even if you have not gotten a claim number, even if you haven't straightened that out, we'll put a special number up on the computer, up on the webinar, and you just have to call that number. And even if you don't have that claim number, schedule for the free evaluation and see what the doctors have to say. We can help guide you through the claim number, complications and so forth over time. Just come in, let the doctors examine you and determine if anything's wrong. If there's no issue and nothing to worry about, they'll let you know. If there is, they'll help you follow up, lock in the claim numbers, follow up with the work comp claims examiners and the insurance adjudicators and so forth. But the main thing is to get the proper evaluation as fast as possible, because as I said, once these conditions settle in, it gets much more difficult to treat. Sometimes we find patients have not been treated for months because they've been getting the runaround from the insurance company about getting a claim number so their doctors can send in bills for their procedures and treatments.
You want to make sure you're getting expert advice.
Sure. I mean, if you're someone that is responsible for making sure your family has food on the table and a roof over their head, and you get an injury, you want to get feeling better and straighten it out and correct it and rehabilitate it as fast as you can, because being out of work is a costly thing. And the long-term complications of injuries, when we see patients that their histories are various accidents over time that were never taken care of, and these people are a mess and they need a lot of work and wish that they hadn't ignored it prior. So I think, from my standpoint, to wrap up saying, keep in mind all these different things, do your due diligence immediately. But if you're injured, call the number that's available, come in for a free evaluation, get some guidance, and make sure you stay on top of this to keep the lid on these things so they don't get out of control.
And anybody watching this, you have any questions, let us know. We'll answer them, get back to you. It was great again, Dave. Every time you're on, everybody loves it. So thanks a lot.
All right, great. Thanks, Brad. We'll talk soon.